Vitamin B6 plays a subtle yet powerful role in supporting heart health, primarily through its influence on homocysteine metabolism, a factor that has been closely linked to cardiovascular risk. Homocysteine is an amino acid produced during the normal breakdown of proteins, and while the body needs it in small amounts for essential processes, chronically elevated levels have been associated with damage to blood vessels and an increased risk of heart disease, stroke, and other cardiovascular complications. Vitamin B6, along with folate and vitamin B12, acts as a cofactor in the biochemical pathways that convert homocysteine into benign compounds, thereby helping to maintain healthy levels in the blood. By supporting this detoxification process, B6 indirectly contributes to the structural and functional integrity of blood vessels, reduces inflammatory stress on the vascular system, and promotes overall cardiovascular resilience. For those looking to protect heart health over the long term, maintaining adequate B6 intake can therefore be seen as a preventive strategy that works quietly yet effectively behind the scenes. The positive aspect of B6's role in homocysteine regulation is that it demonstrates how a single nutrient can influence multiple systems simultaneously. By helping to lower homocysteine, B6 not only supports heart health, but also contributes to better brain function and overall metabolic efficiency, because elevated homocysteine has been linked to cognitive decline, oxidative stress, and impaired energy metabolism. Adequate intake of B6 from foods such as poultry, fish, fortified cereals, potatoes, bananas, and legumes ensures that the body has the necessary cofactor to process homocysteine efficiently without the need for high-dose supplementation. For most adults, this natural approach provides measurable benefits without introducing unnecessary risk, highlighting the elegance of obtaining nutrients from balanced diets rather than relying solely on pills. At the same time, it is important to recognize that vitamin B6, while essential, must be approached with awareness regarding dosage. Prolonged use of extremely high-dose supplements can lead to nerve-related side effects, including tingling, numbness, or burning sensations in the extremities, a condition known as peripheral neuropathy. These effects are rare and generally appear only when daily intake exceeds several dozen times the recommended amount over extended periods, but they serve as a critical reminder that even beneficial nutrients have upper limits. Unlike food-based intake, which is naturally balanced, concentrated supplements can overwhelm the body if used indiscriminately, and homocysteine-lowering effects are often achieved at moderate doses, not megadoses. This dual perspective, recognizing both the benefits and potential risks, underscores the importance of informed supplementation and encourages individuals to focus on consistent, moderate intake through diet or carefully guided supplementation. Another encouraging aspect is that B6's benefits for cardiovascular health appear most powerful when it is part of a broader strategy of balanced nutrition and lifestyle. The vitamin works synergistically with folate and B12, creating a network of biochemical support that optimizes homocysteine metabolism, strengthens vascular function, and reduces oxidative stress. This synergy demonstrates that heart health is not the result of a single nutrient or isolated action, but of a combination of factors that work together to maintain metabolic harmony. Adequate B6 intake, when combined with regular exercise, a diet rich in vegetables, fruits, and whole grains, and the avoidance of smoking and excessive alcohol, creates a foundation for long-term cardiovascular resilience. In this sense, B6 is both a specific and systemic contributor, supporting not just biochemical pathways, but also overall health outcomes that influence quality of life and longevity. The long-term benefits of maintaining optimal B6 levels are further amplified by its accessibility and safety when consumed at appropriate levels. Unlike some interventions for cardiovascular risk, B6 is widely available in ordinary foods, inexpensive, and generally safe when obtained from diet. This makes it an empowering tool for preventive health, allowing individuals to take proactive steps without relying solely on medications or complex interventions. Even in populations at higher cardiovascular risk, ensuring adequate B6 status can complement other strategies, potentially reducing homocysteine levels, supporting vascular function, and contributing to better overall heart health. The message is clear. The vitamin quietly reinforces the body's natural mechanisms for maintaining cardiovascular stability while delivering benefits that extend beyond the heart to brain health, energy metabolism, and immune resilience. Yet the rare risks associated with megadoses remain an important caveat. High-dose supplements can produce adverse neurological effects that may take months to resolve, emphasizing the importance of moderation and professional guidance. Fortunately, these risks are avoidable for most people because the levels needed for homocysteine regulation and cardiovascular support are well within safe dietary ranges. By focusing on consistent, balanced intake through food or moderate supplementation, individuals can enjoy the full spectrum of benefits while minimizing any potential harm. Ultimately, vitamin B6 represents a vital and versatile ally in supporting heart health. Through its role in homocysteine metabolism, it helps maintain vascular integrity, reduces inflammatory stress on blood vessels, and promotes overall cardiovascular resilience. Its benefits extend to cognitive function, energy metabolism, and systemic health, making it a nutrient with far-reaching influence. With adequate intake, thoughtful supplementation when needed, and attention to safe dosage, B6 offers a powerful, evidence-based means to strengthen heart health and support lifelong wellness, demonstrating how small but essential nutrients can make a significant impact on long-term vitality.